Hello, a warm welcome to CREST.BD's Bipolar Wellness Center webinar series. This webinar will provide you with a summary of current research evidence about the relationship between work and quality of life, as well as pointing you to some tools and resources to help you flourish in your work life.
Hello, I'm Dr. Raymond Lamb, here at the University of British Columbia in Vancouver. Please follow me on Twitter, @DrRaymondLamb. It's my pleasure to lead this webinar today on work and bipolar disorder. We're going to start by defining work, then go on to talk about why work is important to your quality of life, and then switch to talking specifically about work and bipolar disorder, and then finish with how you can take action in your own quality of life and work. We should first start off by talking about what our definition of work is. And for the focus of this webinar, we're actually talking about the relationship between paid work and quality of life. Now, we know that having a job is an important part of life for many people, but not everyone needs or wants paid employment. And there is a lot of meaningful volunteer work and other life roles, for example, taking care of children or parents, that's equally important. But for the purposes of this webinar, we're focusing on paid employment. And we know that many job activities are considered more important or less stressful, may be focused on instead of just someone's primary work environment. And of course, everything is individualized so that there's no one-size-fits-all solution for every work issue. So in defining that, let's go on to talk about work and bipolar disorder. First of all, we know that work is really important to people, and it's really important to your quality of life. And that's because work can obviously provide a sense of purpose and identity for many people. There's the satisfaction of getting things accomplished at work. It gives people a feeling of competence and satisfaction. And for many people, the work environment is actually their primary means for social support and networking. And we know that relationships are very important to people, and particularly people with mental health issues. Obviously, work is a source of financial security. It's a way for people to make money for other important life areas. For example, being able to pursue leisure activities or other activities that are important for people. Also important is that work provides a real routine and structure. Kind of regularly going to work, having a regular schedule, we know is very important for people with bipolar disorder in particular. So for all those reasons, work is extremely important to quality of life. And one reason why we should focus on work issues in terms of optimizing your quality of life. Now, when we look at work and bipolar disorder, we know that it is a serious mental health issue, and so it's no surprise that having bipolar disorder can interfere with work functioning. So there are a lot of studies looking at work functioning in people with bipolar disorder. And it's well known that, for example, unemployment rates are higher in people with bipolar disorder than in the general population. And we know that the symptoms associated with bipolar disorder, particularly in the depressive phase, can be associated with interference with work performance, and so people can underperform at work or have reduced productivity when they're at work. And there are some statistics that show that almost half of people with bipolar disorder are unemployed. Now, that statistic is probably a little bit inflated. And that's because those studies tend to focus on people with more severe illness or people who have recently been in a hospital. We also know that many people with bipolar disorder do very well at work, and they function well and can be extremely productive in their work environment. So it's also important to look at what factors are helpful in optimizing work functioning in people with bipolar disorder. When we look at that, in fact, there are a number of studies that looked at factors for success in the work environment. For example, in this review article, which was a meta-analysis of studies looking at predictors of favorable outcomes, And meta-analysis is really just a statistical method for summarizing a large number of studies to come up with some common conclusions. And what this meta-analysis found was that these factors, as listed, were important in having success in the work environment. Top of the list was actually good cognition. And by cognition, we're really talking about thinking, concentration, memory, organizing ability, decision-making, all those things that we know are useful for success at work. And so people with higher rates of good cognition did better at work. We also know that there are some factors like higher education that tends to predict better success. There are also factors relating to the course of illness that are important. So not surprisingly, having a lower illness severity, for example, being hospitalized less frequently, was also associated with improved work functioning. And when there are no other complicating conditions, for example, medical problems or personality problems or other psychiatric illnesses in addition to bipolar disorder, when people did not have those complicating conditions, they did better. But there are also some issues related to the work environment that also factored in terms of doing better at work. And these factors included the ability to cope with workplace stigma. We know that stigma is a huge issue for people with bipolar disorder. So those people who were able to cope better with stigma did better at work. And finally, good relationships at work also factored in for success. Not surprising. Again, we know from many studies that relationships are a key factor in why people do better with conditions like bipolar disorder. So these factors give us some idea as to what to focus on in terms of improving and optimizing your work functioning when you have bipolar disorder. Other studies have looked at things like successful re-entry into work, returning to work after a significant mood episode, whether a mania or a depression related to bipolar disorder. And some of the factors that indicate success include, for example, a good fit between the person with bipolar disorder, the type of job that they have, and the support system that they had in both the work and home environment. So again, not surprisingly, that if people have those supports in place, they will do better in terms of returning to work after a mood episode. The other thing, of course, that's very important is that recovery from the mood episode, if people are not left with residual symptoms related to the mood episode, those people who were fully recovered did much better in returning to work. Other things that we found to be very helpful in terms of success in the workplace include things like having regular assessment of mental health, being able to work with your care provider in tracking symptoms and how they're doing in relating to work functioning is an important component of care. Also, a person actively working to maintain and improve mental health using self-management and other strategies is also helpful in looking at success in the workplace. And then finally, having a focus on feeling connected to others at work. Again, the importance of relationships is also a factor in people having success returning to work after a mood episode. So again, all of these seem to show some consensus in terms of what's important for people to focus on in optimizing their work functioning. So let's go on to see what you can do to improve and how you can take action to improve your work functioning. First of all, we can optimize the treatments that people are getting for bipolar disorder. Medications, for example, is a foundation of treatment, and most people with bipolar disorder are on medications. And we know that medications have many different effects and side effects, some of which may be more or less helpful for optimizing work functioning. For example, there are some side effects of medications that can affect cognition and actually worsen thinking. So it's important for you to work with your physician to optimize the medications that you're taking for bipolar disorder. But we also know that medications alone and symptom improvement alone may not be enough to actually optimize and improve work functioning. It helps, obviously, in terms of getting people to recovery, but there are other things that can be very helpful in addition to medications. And so it's important to also look at other psychosocial treatments, whether it's psychotherapy or occupational therapy. Occupational therapists are a very valuable resource because they focus on some of the challenges and barriers that can affect people returning to work and can offer very practical solutions in overcoming some of those challenges and barriers. So I think we really think that both medication and psychosocial treatments are required to really optimize treatments, optimize work functioning, and especially for people who are trying to return to work following a significant mood episode. What kinds of psychosocial treatments are available? Well, again, that's been quite well studied in people with significant mental health issues like bipolar disorder. And we know that there are many interventions that can support people with mental health challenges in the workplace. A key area of focus has been on supported employment programs. And these are programs that specifically focus to get people returning to work and optimizing their work environment. And in particular, there's a program called Individual Placement and Support. This is kind of taken over from some of the older programs in which people spent a lot of time looking at programs to improve their employment status and ability to work. But it seems that that may not be necessary to spend a lot of time preparing. In fact, what may be more important is an individualized approach to actually seek employment and then to actively support people in that employment using individual counseling and training rather than a kind of a pre-prepared program, a general program for employment. These types of individual placement and support programs are often offered through mental health centers and through community health agencies for people with significant mental illness. So that's something that to look at. The other thing that's very important is to look at what supports are available for you in your particular employment or workplace setting. Many companies actually have a lot of supports available to people, and particularly some of the larger companies provide support through the human resources department. So for example, you should check to see whether your company has an employee assistance program. These are actually confidential programs in which you can talk to an individual counselor about any kind of work or home or illness related issue, and it won't get back to your employer. Many of these counselors are available by telephone or even over the internet and provide a lot of useful information in terms of optimizing work functioning, looking at issues like, for example, conflict in the workplace, whether you should tell your supervisor about your illness, and many work-related issues like that. And then there are a lot of nonprofit organizations that help people return to work and offer many work-related programs. So programs in Canada like the Canadian Mental Health Association offer many work-related programs for both patients with bipolar disorder and other conditions, but also to employers so that they can take more action in supporting their workers who have mental health conditions. Now, people always ask, should I disclose about my bipolar disorder to my workplace? This is a complex and challenging issue, and it's often quite a difficult decision. So there's no one-size-fits-all answer. and there's no simple answer to whether you should disclose at work. We know, unfortunately, that stigma still exists and that some employers will discriminate against people with mental health conditions. There's still the possibility of negative attitudes from coworkers. And so it is a difficult issue sometimes in terms of disclosing. However, on the flip side, we know that supervisors and coworkers can be excellent sources of support when they know that their coworker is struggling with a mental health condition, and in particular when the workplace culture, the company itself, is supportive of people with mental health conditions. We also know that employers have specific responsibilities, legal responsibilities, for dealing with health conditions and disabilities, so that people with health conditions like bipolar disorder do have rights in the workplace to accommodation. And there are disability and anti-discrimination laws that protect the work rights of people with bipolar disorder. So that's also something to take into consideration. So when you're thinking carefully about whether or not to disclose your health condition, you have to factor in some of the pros and cons about disclosing. There are some tools and resources which can help, though, in terms of whether you should disclose and also in terms of optimizing your work functioning. So let's look at those briefly. There's a very good internet resource offered through WebMD looking at tips for managing bipolar disorder at work. And this site is hosted by a health information site that offers a range of tips for people with bipolar disorder, offering really practical suggestions on topics such as whether you should disclose, how you should optimize your work performance, looking at how you should optimize your schedules, and some of the laws relating to discrimination and also to accommodation of people with mental health conditions. So I really recommend this site in terms of looking at some of that information. As well, there are a lot of very good guides available from various agencies. For example, this one is offered through the UK, and it talks about disclosure in the workplace, and it's a guide to employers about how they should handle their workers with a mental health condition, and whether how they can best support their workers in terms of disclosing about having a mental health condition, and how to best accommodate people who are working while they're dealing with a mental health condition. So this is a very useful guide for employers, also useful for people with bipolar disorder to see what information is out there for their employer. In addition, other resources are offered. For example, this one based out of the United States as well, a network called the Job Accommodation Network, which gives helpful and legal information to employers about how to implement workplace accommodations that may be helpful for their workers with bipolar disorder. It offers a description of what bipolar disorder is, as well as some simple practical ways to accommodate people with bipolar disorder and make some of those workplace changes that will make it easier for them to optimize their work functioning. So these are also helpful resources for people with bipolar disorder and employers. In addition, we've developed a free web-based app that's optimized for smartphones, in which people with bipolar disorder and depression can track not only their mood symptoms, but also their work functioning while they're being treated for their mental health condition. It uses very simple, standardized questionnaires and provides results in an easy-to-read format, and then you can track your progress over time and actually print or show your clinician how you've been doing in these important areas of depression, anxiety, cognition, and also work functioning. So please feel free to check that out. It's a free web resource available to anyone. moodeffects.ca. And finally, we have a lot of information at the Bipolar Wellness Center. And again, I'll remind you about that link to the Bipolar Wellness Center, as well as to our quality of life tool that's available at the link provided there. I think by using some of these resources, you can take a really active role in improving not only your quality of life, but also your work functioning. Thank you very much.
Thank you, Dr. Lamb, for that wonderful overview of the relationship between bipolar disorder, work, and quality of life. It's now time for the question and answer session. First off, Dr. Lamb, this participant asks, can you give us any tips on how to stay focused on work when you're struggling with cognitive symptoms?
Well, that's a really important question, because we know that cognitive symptoms are extremely common in people with bipolar disorder. It's one of the most common symptoms that interfere with role functioning, including work. And you know, it's also one of the most common residual symptoms. Even when people are feeling better in their mood, they may still have cognitive symptoms, problems with concentration and memory and organizing and planning ability. So I think it's important to you know, keep track of that, and that's one reason why our mood tracker, moodeffects.ca, includes some questions on cognition, so that you can see how that's improving or not over time. It's not an easy thing in terms of you know, dealing with cognitive problems. The first thing is to optimize the medication treatment if people are on medications, because as I mentioned, medications can have side effects sometimes that affect cognition, daytime sedation, you know, affect memory, etc. So it is important to work with your physician, your doctor, to make sure that the medications are optimized. The second thing is, you know, using you know, kind of tools to help with you know, some of the cognitive problems that people have. And you know, there's this vicious cycle that happens when people have problems with cognition, and then they, you know, make mistakes, and then they catastrophize. So part of that is breaking that cycle in terms of looking realistically at the kinds of things that you can do when you're still struggling with some of these cognitive problems. Things like you know, breaking tasks into smaller, simple tasks, keeping lists, and prioritizing activities are all helpful when people are still having problems with their cognition as well.
Okay, thank you. On to the next question. This person states, I find that your work on bipolar disorder factors for success to be a little disheartening. I'm well educated, I have a master's degree, I've had lots of volunteer experience but very little work experience. In fact, I've only had one successful full-time job. I'm 34 years old and I'm ready to be financially independent. What tips would you have to offer, Dr. Lamb, for somebody who really does have those factors for success in hand but is still having a hard time making entry into the workforce?
Yes, and that's why I said that you know, you have to really individualize you know, kind of programs to optimize work functioning. So for someone who's having trouble getting into the workforce, then you know, obviously you know, programs like career counseling, you know, some of those job entry programs in terms of looking at you know, ways to optimize, you know, for example, resumes, practice interviewing, those types of things are very helpful in terms of getting into the workforce. So similarly, if people have been away from the workforce and trying to return to work, you know, sometimes that's a very complicated issue, and there are many factors involved that aren't necessarily related to the illness and, you know, how well people are being treated for a condition. So, you know, there are obviously these work factors that are involved, where rehabilitation programs, which are multidisciplinary, there are, you know, occupational therapists, psychologists involved, can be helpful in terms of return to work, which you know, may need more than just a, you know, doctor helping with treatment. And so I think that there are programs available in terms of rehabilitation programs, as well as these kind of pre-employment programs that may be helpful for people, and to check with their community mental health resources in terms of looking at for some of those programs.
Thank you. Comprehensive answer. Next up, since so many people with bipolar disorder also have high anxiety, it seems like this would be a common workplace challenge. Do you have any tips for managing anxiety in the workplace?
Yes, you're right that anxiety is a problem for people with bipolar disorder, as it is for people with unipolar depression as well. And you know, there's sometimes a lot of anticipatory anxiety in terms of going to work. You know, when people are recovering from an illness episode. Usually, when we talk about anxiety at work, you know, I say that the best defense is a good offense. You know, trying to avoid anxiety or trying to ignore anxiety is never a good strategy. It just really makes things worse. So part of it is facing the anxiety, facing any stresses that are occurring at work, and you know, trying to deal with them proactively. Now, one of the things, of course, is that, you know, we should avoid things that are known to increase anxiety, and probably the most common one is coffee. Okay. So that's the first thing I usually recommend, is that you know, people try you know, greatly reduce their coffee intake if they're already feeling anxious. Secondly, people may want to, you know, kind of plan regular breaks in their routine, even for a few minutes at a time, in order to, you know, kind of practice some anxiety relieving techniques, deep breathing, you know, that type of thing through the day if they can. And it really helps to have a, you know, kind of a work friend or an ally, just someone that they can talk to. Doesn't necessarily have to be someone, you know, who knows about the illness, but just to have someone there who can, you know, be a friendly face, someone to chat with in the workplace in terms of helping with some of that anxiety. So some of those things are helpful in terms of trying to manage anxiety. We also know that exercise helps with anxiety, and so even taking a walk at lunchtime, if that's available to people, you know, is helpful in terms of calming things down.
Mm. One of the things that's come up in many of the webinars we've held previously has been short mindfulness exercises as well. You mentioned deep breathing exercises, but perhaps embedding brief mindfulness exercises might help with anxiety throughout the workday as well.
Yeah, absolutely, and again, that doesn't need to take a long time. You know, a few minutes is often enough in terms of you know, kind of regularly reinforcing some of the mindfulness techniques.
So you referred to the importance of mood tracking and the mood tracking app that you've developed. This participant on the line asks, what about resources for people who don't find mood tracking useful? And they say, i.e. rumination, by which I imagine they're saying that for some people, when they try to use mood tracking, it doesn't seem to help, in that it over-internalizes focus on the mood state for them, and they tend to get embedded in that. Do you have any tips or resources for people who struggle with mood tracking?
Yes, well, I think, you know, that's one of the great things about the quality of life tool from CREST.BD, is that it not just looks at problems, but also looks at resiliency and you know, things that you know, are more positive in terms of you know, quality of life and life experience. So I think you're right that for some people that rumination is a particular concern. But I think the you know, kind of benefits in terms of you know, checking on things, you know, outweigh some of the disadvantages, because you're going to be working on ways of dealing with you know, with rumination. And again, mindfulness is a very helpful technique in terms of looking at dealing with the ruminative problems that people have. So for people with particular problems with rumination, I would definitely you know, suggest you know, taking some mindfulness training in terms of dealing with that particular symptom.
Wonderful. Looks like this may be the last question that we have at this point, but it's a great one to end with. Are there certain types of work that tend to be well suited to people with bipolar disorder? And the counter side of that, I guess, is are there certain types of work that are ill-suited for many people with bipolar disorder?
Well, you know, I mean, the types of work that are suited for people with bipolar disorder are the same types that are suited for work for everyone. So having a supportive work environment, you know, supportive supervisors and managers, having some flexibility in terms of the type of work that's being done, you know, and making sure that there's, you know, adequate work-life balance, all of these things, you know, would obviously be important for anyone but particularly for people with mental health conditions like bipolar disorder. But we do know that there are some, some job situations which, probably are particularly challenging for people with bipolar disorder. And that's really, jobs where, for example, that you have to work shift work. We know that shift work is a major precipitant sometimes of mood episodes in people with bipolar disorder. The importance of sleep and having a regular sleep schedule, shouldn't be minimized in people with bipolar disorder. So any job where, especially when there are constant or regular, more constant shifts in work schedule are particularly difficult for people with bipolar disorder. And, obviously, people who, where there are conflicts at work, and we know that there are some, toxic workplaces, can be a problem for people with bipolar disorder, although, again, probably a problem for anyone in terms of dealing with toxic work situations.
Wonderful. Well, I think that's drawing us to the end of our question and answer session. I really do want to say a warm thank you to everybody on the line today, first of all for your questions and for participating in this particular webinar. And to draw this to a close, I need to make a special thank you to Dr. Raymond Lamb for joining us for this presentation today. Thank you. Thank you, Ray.
You're most welcome. You're most welcome.
Goodbye, everybody, and thanks again for joining us for the CREST.BD Bipolar Wellness Center webinar series. I hope you have a wonderful day.